Problems may have us, but they sure can't stop us. We're doing the work, we're putting the time, changing one life at a time. This is the This Therapist Has Problems podcast show. Ooh.
Hello. This is Natasha Montgomery, and welcome back to the This Therapist Has Problems podcast. Thank you for stepping into my office today. How are you feeling? What's going on in your world? What's new? What's some things that's been on your mind? How are you feeling? Take a breath. Come on in the room. Let's learn and be open with each other. Our last episode, which was a really great episode, I've watched it a couple times and I've loved it personally. If you have not watched the last episode, it was on the topic of depression. How to recognize functional depression. What does it look like? What does it feel like? And how do you navigate through it? So today we are going to be touching on the topic of anxiety. Before I get into that, I think I'm like 3 subscribers away from 500 and I'm trying to hit this little milestone. If you are not subscribed, hit the subscribe button. Please don't make me beg. Please just hit the subscribe button. Make sure you like the video. The whole point of us asking you to do that, I'm sure you hear all the YouTubers, anyone who makes content, subscribe. The whole purpose is you have to feed the algorithm or you get lost. The whole purpose of me doing this podcast is to provide education on mental health. Please, if you have not yet, subscribe. It helps other people to be able to get this information in their hands, and let's build this community together. So we're going to be talking about anxiety. And to open up this episode, I have an amazing poem written by the beautiful poet Dochi. It says, "Anxiety keeps on trying me. I feel it quietly, trying to silence me. My anxiety can't shake it off of me. Somebody's watching me. It's my anxiety." That was a little jokey joke for anybody who has heard that song. It is a great song. It's so relatable. Dochi is a rap artist and she wrote a song about her anxiety. If you have not checked out that song yet and you feel like you're dealing with some anxiety, at least you can deal with some anxiety and dance to it a little bit. So again, today we are going to be talking about anxiety. My goal is to educate you on these different disorders, what they look like, signs and symptoms to look out for, and then what do we do about it? You don't have to live in a constant state of anxiety, but that is the reality for some of us. Anxiety is not something that, as far as you're feeling anxious before a big meeting or you have a presentation or you're going to do something new. That is a normal level of anxiety. That is not the anxiety we're going to be talking about today. The type of anxiety we're going to be touching on is individuals who deal with this constant lingering sense of anxiousness. Always feeling like something's going on, always feeling like you're missing something. It's kind of like something's sitting on your shoulder just tapping you. And you're having this constant sense of, I'm always stressed. I'm always wondering what I missed. That is the type of anxiety that we're talking about. Let's start with the very, very basics. Anxiety is a normal emotion. Anxiety is a necessary emotion. When working with my clients, I often hear them as they're facing things to say, I just don't want to feel anxious. I just don't want to feel it. Once I get over feeling anxious, then I'll be better. And the reality is, anxiety is normal. We need anxiety. Anxiety is something that our brains, our body has equipped us for safety. So when you have that gut feeling like I'm in danger, it causes you to scan your environment, right? You have that level of anxiety that keeps you on task to do things, that keeps you on time, keeps you focused. A normal level of anxiety is something that we all need. And again, it keeps us safe. The difference is, when you are dealing with that type of anxiety, is what we call situational anxiety. You have a specific situation, you're feeling anxious. The type of anxiety is like an alarm that won't shut off. It's constantly going, and you're always feeling like you're bracing for impact. What we're talking about today is called chronic anxiety. I'm looking at my notes, so I'm looking down. According to the National Institute of Mental Health, about 2 in 10 individuals in the US, specifically adults, this is the range that they were looking at, will experience anxiety disorder at some point in their lives. What does that tell you? It's not rare. In every room, you're chilling with your family, you're in a meeting, at least 2 out of 10 people have some form of anxiety disorder. So it is very common. The difference is people don't recognize that they are dealing with anxiety, because a lot of times when I'm talking to people about anxiety, they're like, oh, I've never had a panic attack. I've never had an anxiety attack. So no, I don't deal with anxiety. But to give you some context, anxiety will look like overthinking everything. Your mind is constantly going, feeling like you always have to be productive. You'll have sometimes difficulties with sleeping, chronic tension in your shoulders and your neck. You get irritable over the smallest things, and then you're always so busy you feel like you don't have time. You don't have time to feel your feelings. You don't have time to sort through what's going on with you. You don't have time to assess, why am I always feeling this way? Sounds familiar? I want you to know it's not just stress. You may be dealing with some anxiety. What are the differences between stress and anxiety? Again, when you're stressed, it is due to a situational circumstance. There's something going on specifically that you can target that is causing you to feel those feelings. With anxiety, like I said, it's this constant noise in the back of your head that you can't quite shut off. What are some signs that you're living with chronic anxiety? For me personally, I'll get personal. I recognize that anxiety was something that I dealt with. And in the past, because I didn't have a lot of knowledge, I thought that it was a trauma response. As I've healed through some of those things, what I recognize for me is that I do deal with anxiety, especially when I am not doing well taking care of myself and resting. I'm always on the go. I always feel like I have my hands busy. I'm always doing things. My anxiety catches up with me in the evening when I'm trying to decompress, trying to lay down. I have this kind of tape running to say, okay, did you do this? You should have done that. Did you miss this? You could have done that. That thing that's constantly going in the back of my head. And there's this running joke. Being an entrepreneur, you don't get no time off. So I'm always thinking, oh, I should have done that. I could have done that. I could have taken some time. That anxiety is saying, that worry, especially being a mom. That tape of worrying about your kids, it's something that kind of plays. So what are some signs for you as far as dealing with some anxiety? When I talk to clients about anxiety, and this is something that I recognize for myself, people say that I'm a type A person. I will own that. I like things to be done specifically. But a lot of people who deal with anxiety, they just attribute it to their personality by calling themselves a type A person, right? They say, oh, that's just how I am. But when we break it down and dig into the details, they recognize that they're dealing with some chronic anxiety. Let's pause right there. Because high functioning anxiety often hides in plain sight, people brush it off and excuse it away, especially like I just identified. Being a woman, being a mom, you're always responsible for something. You're always taking care of something. Your hands are always full. We kind of just explain it away. Just say, oh, I'm just busy. I'm just being productive, without taking stock of why you feel like you have to do that. There's this deep fear of missing something, letting people down, even when you're barely holding it together and you can't understand, why can't I just turn it off? Why can't I just stop? Why can't I just decompress? Here are some quiet signs of anxiety. One is you catastrophize. What does catastrophize mean? Catastrophizing is this constant tape of negative thoughts. Your mind is constantly going to the worst case scenario. It's jumping from one thing to the other. One thing I say to all of my clients, all my friends, I say it all the time. Just because you think something does not make it real. A lot of times when something crosses our mind, we assign truth and fact to it, rather than taking a moment to pause and assess. Going back to the very beginning of what I mentioned, anxiety is something that we've been equipped with to scan our environment for danger. It is something that we've been equipped with to keep ourselves safe. However, when anxiety becomes chronic, our mind is leaning more so towards the negative. We're always looking to say, what is the worst thing that can happen? Because the effort is trying to really keep yourself safe. Again, catastrophizing. You're always jumping to the worst case scenario. Another sign is you say yes when you want to say no just to avoid conflict. That thing that someone is asking you to do, or you're being voluntold to do something, and even though you know you don't have time, you don't have the capacity, you don't have the energy, you say yes just because you don't want people to think you're a bad person. You don't want to take the conflict that comes along with it. Another sign may be you avoid stillness because it makes you uncomfortable. Let's talk about this one. I have experienced this. I've talked to people who have experienced this, who literally do not know how to relax. They don't know how to turn it off because they're afraid if they slow down, they have to sit with their thoughts. They always feel like they're in a state of needing to keep their hands busy. That may be a sign of anxiety. You feel guilty for relaxing. You take a much needed break and there's a sense of guilt that sits in. Why? Because your mind is telling you you should be doing something else. You should be prioritizing something else. That could be a sign of anxiety. Another one is you're physically present, but mentally you're always planning, fixing, or preparing. You sit down to watch a movie with your kids. Mentally, you are not present. You sit down for dinner with your family. Mentally, you're not present. You're driving in your car trying to get somewhere. Mentally, you're not present. Why? Because your mind is constantly going, thinking, planning, preparing, fixing something in your head. That anxiety, it's exhausting. It's invisible until it isn't, right? These are things you can't always physically see. You have all of this narrative running inside your body, inside your head. How do you know when it's time to seek some help? One, if you're listening to this and you're identifying with anything that I'm saying, this is your sign. I'm knocking on your door. This is your sign to dig deeper and seek some help, because that should not be your norm. You should be able to give yourself permission to breathe, to relax, to tune things out and get in tune with yourself and get in touch with peace. What do you do? When do you seek help? You know when anxiety has crossed the line, when stress becomes your norm. This is something that I feel like I have been talking about more and more lately to my clients. We do the work, right? We work through some things in their life gets better. And what I notice is they start to get restless and they're thinking about what could happen, what could go wrong, what could potentially, they're making things a problem. And what I say to them is, you have been used to your life existing in chaos. Peace feels abnormal. If you're taking a reflection on your life and you feel like stress is your norm, being in chaos is your norm, preparing for the worst is your norm, survival mode is your norm, that is a sign that you need to take some stock of how to get a hold of your thoughts and challenge it with reality so that you can find yourself in a space of peace. The next thing is disruption in your life, in your relationships, at work, sleeping, right? Especially sleeping, I find that with anxiety, it attacks your ability to sleep. Why? Because that tape is constantly running. Oftentimes when you think about relationships and work, when we have this constant sense of anxiety, again, it's this fortress that we try to put up to protect ourselves, yet it causes some tension, it causes irritability. These are things that you will see. If you're feeling anxious, you'll notice some rifts in your relationships. The next thing I always say, if you don't address the mental, it will show up as physical. So when you don't address anxiety, you'll likely experience increased headaches, muscle tension, stomach issues. Pause there. We need to talk about the brain-body connection, especially when it comes to your stomach. A lot of people who deal with anxiety will experience stomach issues. So you're like, my stomach is always hurting. I always feel sick. Maybe you have ulcers. That is a sign of high stress and anxiety. Your body will tell the story if you don't pay attention to what is happening to you mentally. The next thing you may notice is avoidance behaviors. You're canceling plans, ghosting your friends, isolating, withdrawing because you just don't want to deal with things around you. And you feel like if I can control what is happening around me, then I can manage my anxiety. That's not how that works, even though we convince ourselves that it does. The next one is a constant fear or worry or restlessness that you can't turn off. This fear of the unknown, this fear of what can happen next. It's constantly running in your head and there's no off button. Take a minute, assess what I just said. I'm going to go there again. You're catastrophizing, always thinking about the worst case scenario. You don't know when you say yes, even when you want to say no, because you don't want to get in conflicts. You avoid sitting still because it makes you uncomfortable. You don't know how to relax. You're always planning things in your mind. These are things to kind of take stock of when you're dealing with some anxiety. When we think about chronic or diagnosable anxiety from a clinical perspective, this anxiety is something that lasts longer than 6 months. So if you're looking to say, is this situational anxiety? Is it just something going on? Or is it something that has been lingering? Clinically, there's always a timeline that we look at to determine where you fall on the scale of being diagnosed with a anxiety disorder. Again, it's something that lasts longer than 6 months. It causes a disruption to your daily life. You're starting to have some physical representation of your anxiety. You're avoiding different things as well as having this constant restlessness. There are several types of specific anxiety disorders, and I'm going to get into these more in my shorts. So I often will do a long form podcast giving you a general understanding, and in my shorts that I post or my reels that I post, I go into details on each of these disorders to provide you with additional information. I'll just give you an overview. The first one is generalized anxiety disorder, or GAD. General anxiety disorder is a specific diagnosed disorder associated with anxiety. Those symptoms that I just listed above, those are the criteria that we look out for to diagnose you or anyone with general or anxiety disorder. Factor of GAD is you worry about everything all of the time, and it's something that is long lasting and isn't affecting your quality of life. The next type of anxiety disorder is social anxiety. This is something that I am seeing more and more, specifically related to younger adults or children who have existed during the pandemic. Social anxiety is a fear of being judged or embarrassed in public. It causes a lot of avoidance, isolation, not wanting to go out. One thing in kids, especially kids who are kind of in their formative years, as far as those socialization years, so elementary, middle school, even high school, right? To say if they spent almost 3 years in isolation, it has been very difficult for those kids to reintegrate themselves into society because they've gotten used to functioning in isolation. So making a phone call feels terrifying for them. Going to the store by themselves seems impossible. Even as adults, we deal with social anxiety. So feeling like same way that these kids existed during the pandemic, adults did as well. Social anxiety is something that we're seeing a lot of. The next anxiety disorder is panic attack disorder. Panic attacks is a repeated panic attack with no specific triggers. A lot of times when I ask clients, especially during intake, I want to know specifically what does panic attacks look like for them, and if they're able to identify what triggered the panic attack. But a lot of times they're like, I don't know. I just start feeling anxious. I started feeling overwhelmed. In a moment, we'll circle back and talk about symptoms of panic attacks. The next anxiety disorder is phobias. This is a very specific type of anxiety. It is an intense fear to something very specific. For instance, people have a phobia of spiders or snakes or flying on an airplane. I was just watching an episode of Good Morning America, and Nina Parker said that she had a phobia of mayonnaise. It can be anything, right? That you have this intense fear associated with it. But again, phobia is very specific. Let's circle back to panic disorder. When you have panic disorder, a lot of times you will identify with experiencing panic attacks or anxiety attacks. Those can be used interchangeably. Symptoms of a panic attack. You'll have, and these depends on the person, right? They may hit all of them, you may hit some of them, but this is generally what to look out for to let you know I am experiencing a panic attack. And it will often feel like a heart attack in some cases, where people feel like, oh my God, I have to go to the hospital. You may experience a racing or pounding heart, shortness of breath or hypoventilation, trembling or shaking, sweating, chest pain or discomfort, nausea or stomach problems. You may feel dizzy or lightheaded, and then some tingling and numbness. Listening to these, you're like, those could be symptoms of a heart attack. If you experience a panic attack and you are not able to calm yourself, please be your own judge and say, okay, if I don't know what's causing this, I'm feeling weird, I'm feeling strange. If you feel like you need to go to the emergency room, urgent care, and it may be a health issue, do what you need to do to make sure that you're safe. If you recognize that these things are coming up for me frequently, I felt this way a couple times before, you may be having a panic attack. Try and calm yourself down. And I'll give you some techniques in a moment to help you kind of manage some anxiety, but assess some of these symptoms from a psychological perspective. You'll have intense fear. You'll feel like you're losing control. There'll be kind of a fear of being detached from reality. You'll be having difficulty concentrating. There'll be a physical restlessness or irritability, and then excessive worry. These physical symptoms in conjunction with psychological issue or symptoms will let you know if you are experiencing a panic attack. I just threw a lot of information at you. What the heck do you do about this? First thing is understanding that, again, anxiety is a normal part of life, but it should not be a constant in your life. If you are experiencing this, understand that you're not a failure, you're not falling apart, you're not weak, you're just overwhelmed, and you need to use some techniques. You need to get support in order to manage your thoughts and feelings, in order to shift your behaviors. I'll give you some techniques as far as ways that I help clients specifically with anxiety. Cognitive behavioral therapy, and I've said this a couple of times throughout this podcast episode. Cognitive behavioral therapy, the whole point of that is to help you challenge your thoughts. Again, just because you think something does not mean it's true. If you're able to get support by using cognitive behavioral therapy, cognitive thoughts, if you're able to assess your thoughts and change the way you think, your behavior will follow. Another technique for managing anxiety is using mindfulness or grounding techniques, and that reconnects your body and your mind. When you're feeling anxious, a lot of times you're lost in your head and you're very much disconnected from what is really happening around you. They say that depression is when you worry about the past. Anxiety is when you worry about the future, and the goal is for you to sit right in the present. So mindfulness and grounding techniques. I always am a big proponent for progressive muscle relaxation. It causes you to be physically in the moment, where you start from your toes, you work your way up, physically squeezing each part of your body and releasing. It's making you think about your body. You're feeling your body by squeezing and releasing, and you're working your way up. It's causing you to focus in the moment and sit in reality. Another method is the 5, 4, 3, 2, 1 method. What are 5 things you can see, 4 things you can hear, 3 things you can smell, touch, taste? You're working through, again, sitting through the present. Another method for grounding technique is the 4x4 breathing technique, right? You breathe in for 4, hold it for 4, out for 4, hold it for 4, in for 4, hold it for 4, out for 4, hold it for 4 again. The goal is to connect your mind with your body to cause you to sit in the present. Those are mindfulness and grounding techniques. The next technique that can be useful in treating anxiety is psychoeducation. What does that mean? This is what we're doing today. We're educating you on what the disorder looks like. How do you treat it? How do you move forward in a way that specifically relates to you? With psychoeducation, you need to learn what exactly is anxiety, What are your own specific triggers? How does these triggers shift your thoughts and affect your behavior? The goal is to teach you what's actually happening in your brain and how it affects your body. The next technique is somatic awareness. Somatic awareness, again, is the technique that really helps you to be present with the body, right? Because anxiety lives in your body just as much as it lives in your mind, it's important to be in touch with who you are physically so that you can release some of that anxious energy. I have been like on this energy thing lately, and it's so real. Energy lives in the body, and if you don't do anything with it, it will affect your internal body. So if you're feeling overly anxious, that's why exercise is so effective. You're physically moving this negative energy out of your body. You're moving this anxious energy out of your body. Somatic awareness is a therapeutic technique where they walk you through different things that you can do to connect with your body and move the negative and anxious energy out of your body. One tool that I recommend that is super quick guide is the GAD-7. What is that? It is a very simple screening tool specifically for generalized anxiety disorder. There's a scoring ranking on there. So if you score 10 or above on that rating scale, maybe a signal for you to reach out. You're dealing with some anxiety, and getting support would be very helpful. Remember, anxiety thrives in silence, right? It lives kind of underneath the surface. It's something that's easily ignored and kind of brushed away as, oh, that's just how I am, versus us taking the moment to call it what it is and do something about it. If this episode has hit close to home, I want you to take a moment, recognize that it's okay to be reflective. It's okay to do some self-assessment and truly be honest with yourself about spaces that you may be struggling in. I've admitted it. Hi, my name is Natasha, and I've dealt with some anxiety. It's okay. It doesn't mean you're broken. It doesn't mean that you're beyond repair. It just means you need to carve some space out to prioritize taking care of yourself. Again, take the GAD-7 if you're like, oh, I need some evidence. It asks very specific and targeted questions. One thing I will say, when you're doing that assessment, it will ask within a time frame to say, in the last 7 days, have you had any of these symptoms? There's no point of taking an assessment if you're not going to be honest. Honestly answer the questions, see where you fall. Based on that, get some support. And I know that I said, look for a 10 or above. That's like, you need to get some help. But if you got an 8 or a 7 or a 6 and you know that anxiety is a space that you struggle in, push yourself to get the support that you need.
We're doing the work, we're putting the time, changing one life at a time. This is the This Therapist Has Problems podcast show. Ooh.